So, welcome to Aureum Physio Spotlight Series, where we connect with exceptional professionals who are elevating the way that we care for our body as a whole. Today, I'm honored to be joined by Dr. Abby DeVries, a physician specializing in women's health and menopause care. She is the founder of Sabia Health NC, a direct primary care practice dedicated to personalized, relationship-driven medicine, primarily focusing on women in midlife and helping them negotiate the changes occurring with menopause support, hormone therapy, preventative wellness, and chronic condition management. We're diving into an incredibly important and often overlooked topic: how perimenopause and menopause influence musculoskeletal health, pain, performance, and recovery. Dr. DeVries, thank you so much for being here. To let Aureum Physio's audience get to know you a little bit better, I would love for you to tell us a little bit about your background and what inspired you to open Sabia Health.
Sure. Well, it's a pleasure to be here today. I'm a family physician. I've been practicing for a little over 20 years and have worked in a variety of different spaces in the healthcare system. And last year made the jump to the direct primary care model, which allows me to have much more time with patients, to not have to worry about insurance coverage for the time that I'm spending so that I can really provide very personalized care. And as I've sort of aged into this period of life, I've also become very passionate about helping women to stay healthy and to age well, and also to really feel good in this phase of life when, it can be a chaotic phase where they are, dealing with children who are still at home, maybe aging parents in the peak of their career, and want to have some time for themselves as well. So to really make sure they feel good. And then also, this is a transition to a time when eventually people start to develop some chronic medical conditions. So really making sure that they're being screened for things and that they know how to really take care of themselves the best way possible.
Awesome. Kind of on that note, leading you to open Sabia Health, did you see any like specific, or what would you say are like the bigger gaps in traditional healthcare for women in midlife that you feel like the direct primary care model and Sabia Health as a whole is really good at identifying and filling in the gaps there that traditionally are often overlooked or
Yeah.
missed?
Yeah, so I think, hormone replacement therapy is one of them. I mean, we're undergoing a really huge shift in medicine right now where people are kind of coming back to prescribing in an evidence-based way. But it takes a conversation to kind of go through the risks and benefits for patients and then figure out what formulation you want to start with. And then you have to kind of tinker with the doses. So it's something that's very hard to do in a 15-minute office visit. And then you also need some of that follow-up. So as part of my membership, any kind of communication about symptoms and things like that is all covered. And so people feel like they have this kind of direct line to be able to get to a dose that works for them for now, and then it may change again in the future. So hormone replacement therapy for sure. And then, pelvic health is another thing that even if people are seeing a GYN, they're not always being asked about pain with sex, urinary incontinence, things that really affect their quality of life. And so I have time to ask questions, do an exam, think about other partners to pull in to make sure that they're, being effectively treated for that as well.
Awesome. And I think, we all know, especially women and women in healthcare, but I think, a broader sense, there's a lot of misconceptions or unknowns that people have about like when does perimenopause typically begin? How would you define perimenopause and menopause clinically? What's the
Mhm.
typical age
Yeah.
range, and what are some misconceptions that you often deal with?
Yeah. So menopause is one day, the when you've been 12 months without a period. The average age for that in the US is age 52. And then perimenopause is the phase kind of leading up to that, which can be up to 10 years. So if you think the average age is 52, I have women who are already postmenopausal at 45. If they had symptoms for up to 10 years, that's actually late 30s. So there's really no kind of too early to start having symptoms related to perimenopause. And early menopause would be before 45. Premature ovarian failure or insufficiency is before 40, when there's significant risk factors for cardiac disease and osteoporosis. So if someone's already hit menopause at 40, that's a different kind of intervention. But really, anybody late 30s who's experiencing some symptoms that are a change from their baseline, that could absolutely be perimenopause. And then postmenopause, we typically just say menopause, but it's really like that phase past the 12 months.
And then what do you think are those symptoms that are often missed or
Yeah.
misdiagnosed?
Yeah. So, I mean, the most common is sort of your typical hot flashes, feeling just hot overall, sleeping more poorly, brain fog, joint pains, vaginal dryness, decreased libido, all of that can start even if you're still having very regular periods. And then in the perimenopause phase, you also can start having changes in your period where they're, more erratic, heavier, and with associated with more pain. Oftentimes women will need to go on medication for birth control in their 40s just to control their periods because they're actually having, anemia. So the period irregularity, and then obviously eventually the period goes away. And then the thing that we don't see that is asymptomatic is the decrease in bone mass. And that starts in the late perimenopause phase in the year or two leading up to menopause. And that's something that, once you can rebuild bone, but it's a lot harder. It's easier to maintain bone. So that's something that I think about as well for women.
Yeah. And that kind of leads directly into kind of like what I wanted to, really kind of talk about. Like, obviously, in the physical therapy world, we deal, primarily with the symptoms that would be related to musculoskeletal issues, primarily the bone loss. We do often get referrals to PT for patients with either osteopenia or osteoporosis to try to do exercise-based intervention with resistance training and to really help guide the patients into a more, especially those that might not be as familiar with strength training, to guide them into a very, intentional, progressive, resistance-based program that is going to be safe and effective for them to do. So, that loss of bone, I think, is probably the most common musculoskeletal change that the general population does associate with perimenopause and the menopause changes. But needing a more global viewpoint of like the other changes that are occurring with the loss of estrogen. We know that estrogen plays a big role in collagen development, and as the estrogen levels lower, the types of collagen may decrease as well. That can lead to tendon stiffness and degradation of articular cartilage. How do you think that physicians responsible for women's health can help manage and work better together with physical therapists, and then also physical therapists can work better with physicians in terms of women's health? I think that from an educational standpoint for PTs, and this is not speaking for every PT, but we are often educated towards red and yellow flags to know when referrals out are, something of importance in terms of severity of condition. But, I think there's a lack of knowledge of how can PTs identify a female patient that might be in these stages of, hormone levels changing that's contributing to gluteal tendinopathy, frozen shoulder, XYZ. Where do you think kind of a good position for physicians to refer to PT, but then also PTs to have that identification that maybe something else needs to be done so we don't feel like we're running on a hamster wheel of trying to program these, rehab programs for our patients? Like, how do you kind of see how we can work better together as a more holistic team?
Yeah. Well, the first thing that comes to mind is frozen shoulder, which is a classic kind of perimenopause. As your estrogen levels drop, very commonly people will have the adhesive capsulitis in the shoulder because estrogen is anti-inflammatory, and not to mention the collagen production. So people, especially if they are not super active, but even active people, it can freeze up very quickly. So that would be your number one, like a PT identifying that in a woman in her 40s, like consider HRT along with all the therapy that you would do. And then there's that. So that's the main, like, really kind of dramatic thing. The other is more just kind of general aches and pains. A lot of times people will complain of hip pain, especially if it's bilateral. I feel like it's less likely to be something biomechanical and probably more likely linked to the estrogen. So women who will say their hip pain goes away once they get on estrogen. I think other joints as well, but I think the hips seem to be pretty common. And then just overall kind of fatigue and not feeling like they have the energy to be mobile. And so developing some symptoms of kind of just a sedentary lifestyle. And so if people are telling you they don't feel like they have the energy to even, do their exercises or they can't sleep, that would be another big thing that I'm sure comes up when people are in your exam room.
So, if those folks come in and, we're going about like the therapy interventions, and I do think that, a referral to a physician, if they haven't already started to explore HRT or hormone imbalances, how can we best have that conversation as a physical therapist with the patient when we're obviously not the experts, but kind of give them a little bit of like a baseline support to encourage them to go seek that care from you with Sabia Health and
Right.
not, send them spiraling.
Yeah, yeah. Think, the just to kind of bringing up that like this as your body changes as you enter midlife, this is something that you see commonly, and that the guidance is changing around kind of the risks of hormone therapy and the benefits, and it would not be it would be something that would be a good idea to bring up with your provider. And I usually tell people, like, if you have a primary care provider or you have a GYN, start there. Again, the traditional medical field is evolving rapidly and then there's people who were prescribing before the big study in 2001 who've kept prescribing. So if you're lucky, you have a provider that with conversation and the risk benefit analysis with you and talk about it. But then if not, seeking out someone who's the menopause specialist. And menopause.org has a list of providers who are certified as menopause practitioners. I'm on that list, and there's several in the triangle as well. Um, so I think it's more just like, you don't have to keep suffering. I think women have really kind of learned, over the centuries that like this is their fate. They just have to deal with it. But I think just, coaching people that, there might be something more we could do about this and it's worth exploring. I would really
So
encourage
kind of
people
on
to do
that
that.
note too, for people that might not know too much about like hormone replacement therapy or even what sort of like medicinal treatments are available to them in this like life change, can you clear up a little bit, about the confusion over hormone replacement therapy? How do you help patients decide what's best for them? Who's a good candidate? And what are like some safety myths and concerns that you often deal
Yeah.
with?
Yeah. So I could talk for about an hour on this. So I'll try to hit the highlights. So the big thing is that in 2001, there was a study that it had been going on for several years, but the news came out in 2001. The headline was that hormones cause breast cancer. So in the first place, that was not actually what the data showed, but it was then basically people stopped hormones overnight. I was in medical school then, didn't really learn how to manage hormones. The bottom line is that that's not what that study showed. And then we have new data still showing that that's not the case. Estrogen alone actually has a lower risk of breast cancer. And it was a synthetic progesterone that we don't use anymore that was most likely contributing to the increased risk of breast cancer. And in the women who got breast cancer diagnoses, they were still less likely to die than women who were not on HRT. So the breast cancer thing, there's considerations if you have a history of breast cancer or very high risk, that certainly you want to have that conversation. We worried about blood clots and stroke and cardiovascular disease. We now use a transdermal preparation almost exclusively, although we still do sometimes use oral. And that with thermals, that is much, and like I mentioned, we now use bioidentical progesterone rather than the synthetic. So we're using safer medications, and even with the old medications that we use, there was still a major benefit for bones, for symptom management, and not such a bad risk profile for the cardiovascular disease and the breast cancer that we were kind of told in the media. So I kind of go through that with patients. And number one is like, let's treat your symptoms. Let's help you feel good now because it's very clear that nothing is going to be more effective than estrogen to treat this. It's the loss of estrogen. So there's no herbs that are much less safe because they're not regulated in the same way. So the medications that I prescribe almost exclusively are FDA approved. They're regulated very heavily. You know what you're getting. They're bioidentical. I will occasionally do some compounded things if needed, but you're safe going with the things that are regulated and the best studied. And then there's the bone health part of it. So I think we are headed towards an epidemic of osteoporosis that we are not prepared for, because we don't screen typically till people are 65 and then it's too late.
Mhm.
So I'm a big proponent of getting a DEXA as you're hitting menopause so you know what your baseline is, and then considering hormones both for symptoms and prevention of osteoporosis, for which it's got that indication with the FDA. So that's a couple of the highlights. Anything you wanted me to hit on that I didn't talk about?
No, I think that's great. Do you ever have any non-hormonal options for any patients that might have a history of breast cancer that might not be candidates
Yeah.
for HRT?
Yeah, there are a few. There's some medications that are mostly they're off-label, depression medications. There's a medication we use often for pain. And then there are some, they're called selective estrogen receptor modulators that we can use that actually the breast receptors do not respond to it, and so sometimes people can use those. In my practice, almost everyone's coming to me because I'm prescribing hormones, but there are options. And the bone, there are things for bone as well, specifically if people have osteoporosis and vitamin D, calcium, strength training. Can't emphasize that enough. You need to do that even if you're taking hormones.
So if a woman, in her late 30s or 40s or 50s is starting to notice, like, have that suspicion that changes are starting to occur, what would you say, like, the first three steps for someone to do, to help prepare themselves as best as possible, to your
Yeah.
point, not to let time go by where you almost get behind the curve, but try to stay on top of it?
Yeah. So the first thing I'd say is to educate themselves to the degree they have interest. So there's a couple of they really become sort of influencers, but they're physicians first, and they're very evidence-based. So Mary Claire Haver is an OBGYN. She has a book, a podcast. So depending on how people like to get their information. Kelly Casperson is a urologist, and she also has a book and a podcast. And then Rachel Rubin is more on social media. I don't think she's written a book, but she's been on other people's podcasts. And so just kind of educating yourself on the most up-to-date data and then making an appointment with your usual source of care and starting there and make it an appointment specifically for HRT discussion because if you try to do it during your physical, the physician's not going to have time. And so that would be the first two things. And then if you don't get feel like you get the right answers or enough time, then look for one of these places that are specializing in menopause care and can have that very nuanced conversation and spend the time with you to help you make the right decision.
And then for folks that, might want to seek out someone such as yourself that really, emphasizes your knowledge and expertise in menopause care, but maybe they want to start with you before going to just a general primary care. Is that an avenue for
Mhm.
folks to come see you before
Yeah.
maybe these changes
Yeah.
occur?
Yeah, so I think I'm really there's so many women who are already in the space who are underserved that I'm really trying to provide that service, but I also love talking to women who are, still probably premenopausal about how they can make sure that they're optimize their nutrition and their strength training and that we've screened them for things. So it's never too early to sort of start thinking about, how to stay healthy. And so I do individual visits specifically around menopause. But then what I really love doing is taking care of the whole person. So I'm hoping to build that practice. But there are, again, several really excellent, some longstanding clinicians in the Triangle area that do menopause all day long and are very knowledgeable.
Amazing. And Dr. DeVries, this has been such a great and empowering conversation. And if folks do want to seek out your care and rely on your expertise in helping them navigate age-related changes or even just looking for an awesome provider to take care of them as a whole, what is the best way for someone to find you or get in touch with you or get set up with working with you?
Yeah. So you can schedule directly on my website. It's Sabia Health, Sabia Health NC.com. And I also offer a free 30-minute consultation. So if people just want to kind of, figure out whether we might be a good match, they can do that, or they can join, or they can schedule a one-off visit. And so that's on the website. I'm also on Instagram at Sabia Health NC. And so I post a lot of health-related information there if people want to kind of just see what my overall philosophy is. And those are the two best ways to find me.
Amazing. Well, thank you again for joining us on this edition of Aureum Physio Spotlight Series, where clinical excellence meets whole person wellness. If you're navigating perimenopause, menopause, or new musculoskeletal pain, know that you don't have to do it alone. Aureum Physio is definitely here for your musculoskeletal issues, and Sabia Health is here to help you navigate any sort of health or age-related changes, especially for women's wellness. We're here to support you every step of the way. Please reach out to Aureum Physio or Sabia Health for any of your needs. Thank you again, Dr. DeVries, for being here, and we look
Sure.
forward to working with you in the future.
Thank you so much.